In this video, we will be seeing about CSS department. So what is CSS? It is the Central Sterile Supply Department, comprises of services within a hospital which receives, stores, processes, distributes and controls professional supplies and equipment, both sterile and non-sterile, to and from all departments of the hospital for the care and the safety of the patients. Ideally, CSSD is an independent department with facilities to receive, clean, pack, disinfect, sterilize, store and distribute instruments and supplies as per well delineated protocols. By customs diets, medicines, laundry, supply of blood and a crystalloid are not included in the activities of CSSD. Background: history and development. The concept of sepsis was coined by Lister and Koch was a result of discovery of microorganisms. With the discovery, the need for aspect technique in handling the sterilization for equipment used in surgery medicine was felt to be the utmost importance for the care of the patients. Modern concept of CSD was derived during the Second World War. So this is some history. 1928, American College of Surgeons started CSSD. World War II, British SDS units. Cambridge Military Hospital, 1955. 1965, first CSD in India by Safadaranjan Hospital in India. So, objectives and functions: to provide sterilized material, contributing to a reduction in the incidence of hospital infection, to avoid duplication of costly equipment, to maintain record of effectiveness of cleaning, disinfection and sterilization process. Other objective functions are to monitor and enforce control necessary to prevent cross-infection, to maintain an inventory of supplies and equipment, to stay updated regarding development in the field, to provide a safe environment for patients and staff. Designing a CSSD. The size and the location of CSSD varies based on the need and the application of the hospital. 7 to 10 square feet per bed is recommended. It should be located as close as possible to the operation theatre, accidents, and emergency department and wards. The CSSD layout should be designed for the unidirectional flow. The CSD should have 4 zones of a smooth workflow: unclean and washing area, assembly and packing area, sterilization area, and sterile area. So this is a general CSSD design concept: soil zone, clean stone and sterile stone with having barricade between them. Planning of CSSD department. So it consists of quality, physical, functional, personal, equipment, financial and preventive aspects. Planning of CSSD. The materials items from contaminated and sterile areas should not get mixed. There should be physical barrier between clean and dirty areas. The floor should be smooth, impervious, non-skid and robust. Relative humidity should be maintained at 45 plus or minus 5%. Clean area should be maintained at positive pressures. The minimum ventilation rate should be 6 to 10 air changes per hour. Work area should be made of marble and granite stainless steel. Sterilization must be planned for autoclaving by steam as well as by gas. Location. CSSD location should be close to the casualty, operation theatre and wards, which are the largest consumer of sterile material. In multi-storied buildings, CSSD may be planned in the lower floor right under the operation theatre, where the vertical movement will be the quickest possible movement of the material. So this is a floor space. So beds available 75 to 99. Floor space required for CSD is 10 square feet, and for 300 or more it is 7 square feet per bed. So this is the layout of CSSD. Red zone indicates contaminated zone, denotes blue zone indicate clean zone, and green zone the sterile zone, and the arrows indicate the flow of operation between these zones. The layout designing principle. There are no backtracking of sterile goods. One-way movement from receiving counter to the issue counter. Sterile area should be prior to the sterile storage and issue. Receiving counter must be away from the issue counter. Separate receiving and issuing counter should be maintained. There should be minimum 6 basic divisions in CSSD: cleaning area, drying area, packing area, sterilization area, storage area and issue counter. All these are in one-way direction. Physical facility and equipment availability in CSSD ranges from washrooms to auto enclaves. Nature of their work ranges from dirty to clean. Provision of space percentage ranges from 20 to 26%. Workflow. Major activities in a CSD: receiving the used item from the user departments, cleaning, packing, sterilizing, storing, distributing to the user departments. Okay. Workflow of CSSD starts from receipt, rinsing, cleaning, drying, checking, sterilization, labeling, storage, issue and distribution. Workflow. As I told, it is only one-way flow from dirty, clean and sterile, and there is a red line principle that it flows in one direction and a strict odd barrier between these